Rheumatoid arthritis is the most common inflammatory arthritis as we see in the society. Especially after COVID, the incidence of rheumatoid arthritis has markedly increased. It's again an autoimmune disease in which our immunity cells work against our own body and starts destroying our body. It's an inflammatory condition in which various inflammatory cytokines, the level increases abruptly in our body because of the formation of few antibodies, and they start destroying the joint rapidly. Most commonly, it's the symmetrical joint involvement, like joints of both hands, the joints of both feet get involved. Yeah. And it is definitely different from other most common kind of arthritis, which is osteoarthritis. So people do get confused between rheumatoid arthritis and osteoarthritis. Osteoarthritis is the age-related degenerative disease in which joints get destroyed and the articulation gets destroyed because of the aging process. There's a lot of wear and tear and inside the joint, because of which the how we normally explain is the greasing or the hyaluronic acid which is there in between the joints, the cartilage which is there in the joint, that gets destroyed, and thus the normal shape or the normal articulature of the joint gets disrupted in osteoarthritis. So for that, lifestyle is very important. There are not much drugs which are very helpful in osteoarthritis. And whereas rheumatoid arthritis is totally different, it's an inflammatory disease, very common in young people. It's not very common in old age, whereas osteoarthritis is more common in older age. And that's how we differentiate between rheumatoid and osteoarthritis. Rheumatoid arthritis, it's much more common in females as compared to males. So hormones play a very important role, especially hormones like estrogen, which is there in females, that plays a role in rheumatoid arthritis. Smoking is a very, very big risk factor. If a person is smoking aggressively, then chances of developing rheumatoid arthritis are very high. Then genetic factors play a very important role. If any of your family members have rheumatoid arthritis, so yes, then there are more chances of you developing rheumatoid arthritis. And then obesity, bad lifestyle, high BMI, and bad kind of eating and being very lethargic all the time and having repeated infections in the gut. So these are the risk factors of you developing rheumatoid arthritis. It's very, very important if someone should be knowing what are the early symptoms that you can think of you developing rheumatoid arthritis are. If you have a lot of early morning stiffness, like when you get up in the morning and your hands are very stiff, you're not able to make fist or chop medicines or knead your flour or things like that, or do any kind of household activity, it's very tough because there's a lot of stiffness and joint inflammation in the morning. So if you see any of these joints, especially small joints of the hand, like these joints or this joint, wrist joint, if they get inflamed, there's swelling in any of these joints, and there's symmetrical swelling generally. Like if this hand is getting involved, then definitely other hand will also be getting involved most of the times. So yes, if there is symmetrical involvement, there's a lot of inflammation, stiffness, pain in the joints. Then these are the early symptoms of rheumatoid arthritis. Other than this, you'll be having a lot of fatigue and tiredness. There can be anemia in a lot of patients. Your HP will be less as compared to the normal population. And some can have eye involvement, early eye involvement in the form of redness, pain, blurring of vision, that they can have scleritis or uveitis. Then you can have a lot of dryness in the mouth as well as eyes, what we call as Zika symptoms, which are commonly associated with rheumatoid arthritis. Then some can have early lung involvement. So in rheumatoid arthritis, lung involvement is very common if it's chronic, if RA is chronic. But yes, in some cases, lung involvement can be the first manifestation. So you're having persistent cough, which is not getting relieved. And if some physician is getting your CT scan done and there are ILD features in CT scan and there are no other causes, then yes, you can have any of the autoimmune diseases, and rheumatoid arthritis also should be ruled out as it is one of the causes. Rheumatoid arthritis, the most common joint which is involved is small joints of hand. This joint is not involved generally. These joints, this joint, wrist joint, elbows, jaw, then shoulders to some extent, then small joints of the feet. These are the most common joints which are involved in rheumatoid arthritis. You will notice a lot of swelling and tenderness initially, but gradually over the time, if you don't take treatment properly, then these joints tend to get deformed. Like the shape will go like this. There'll be deformity. You won't be able to do anything with the hands or make fist with the hands. So that is like a chronic stage if rheumatoid arthritis is not treated well on time. So rheumatoid arthritis can easily be diagnosed if you go to a doctor with these complaints, like you have morning stiffness and you have pain and swelling in these common joints which I have mentioned. And if they examine you very well and looking at the age and taking your good detailed history, 90% of the cases, the rheumatoid arthritis is easily diagnosed. Then in remaining 10% of the patients, if you're not very clear, then yes, we have few blood tests like rheumatoid factor, anti-CCP, ESR, CRP, and that's how with these bloods we help in diagnosing rheumatoid arthritis. Then X-ray of rheumatoid arthritis, if it's present for a very long time, then there are few X-ray findings by which we can easily diagnose rheumatoid arthritis. And nowadays, ultrasound is also a very good entity which is very helpful in diagnosing rheumatoid arthritis at early stages. People never ask about diabetes or heart disease or hypertension, that if it's curable, they just keep taking medicine. But yes, when it comes to rheumatoid arthritis, there are a lot of myths that is it curable? Do we need to take medicines throughout? So first we need to understand very well that rheumatoid arthritis is an autoimmune disease, just like diabetes or thyroid. Diabetes and hypothyroidism are also autoimmune diseases, and like there are a lot of other diseases as well. So there's a disbalance in your own body. This disease is developed inside your own body. It's not like an infection, malaria or dengue that you treat for some time and then you're free from that disease. It doesn't happen like that. So we have to work on your immune system. We have to give few immunomodifiers, and they have to be given under proper regulation and surveillance of the doctor. And yes, you have to take medicines for a very long time. But if you come very early, like if you come within first 3 weeks, which is called the window period of the rheumatoid arthritis, if you come within first 3 weeks of the symptoms and visit a rheumatologist, then early diagnosis and early good aggressive treatment can get you in remission. Like your disease will be almost gone. You'll be taking very minimal medicines. And in 20% of the patients, there is a chance of getting into drug-free remission. Like you'll be totally free from disease and you won't be taking any medicines as well. But that happens only 20 to 30% of the patient. The remaining patient, yes, they tend to take and they should be taking medicines regularly, but those will be very minimal medicines. Smoking is definitely no. We should not be doing any kind of smoking, whether it's active or passive, even tobacco chewing. No tobacco should be there in your daily life. And you should be doing regular exercises because you have to build up your muscles. And there are no direct as such diet restrictions other than taking a lot of junk food or a lot of high fat rich food that should be avoided. High amount of sugars should be avoided, but otherwise you can have all kind of a healthy normal balanced diet you can have. So among precautions, smoking, excess body weight should not be there, regular exercises should be done, and just leading a normal healthy life, avoid overthinking, take care of mental health, and take regular medicines. That is what is needed.